Hi, can you go ahead and tell me your full name and your date of birth? Okay, thank you. So my name is Khadijah. As you know, I'm the student nurse that's been taking care of you today. I have some discharge instructions for you that we're going to go ahead and go over. And I also have a handout that I'm going to give you so you can follow along as I go through the teaching. And so you also have something to refer back to when you're at home if you have any questions. So as you know, you were diagnosed with hypertension, which is high blood pressure, and the doctor is going to be sending you home on a medication to take. So the name of the medication is Lisinopril, and as I stated, it's to manage your high blood pressure. So how you take this is you're going to be taking one 10 milligram tablet by mouth daily. You want to make sure it's usually within a 24-hour period that you're taking this. So as some time has gone by and you remember that you had forgotten to take a dose, you want to go ahead and take it. If it's close to the 24-hour mark when you're supposed to take your next dose, you don't want to double up. Just go ahead and take the next dose as scheduled. So how the medication works in your body, it makes the blood vessels relax in order to lower your blood pressure and decrease the amount of work that your heart has to do. So while taking this medication, you want to make sure that you're monitoring your blood pressure closely. You want to make sure that you check your blood pressure prior to taking each dose, and this is to make sure that that your blood pressure is within an acceptable range prior to taking the medication. And this is because the purpose, as we stated, was to lower your blood pressure, so we don't want it to be too low. Since you've been in the hospital, we've been showing you how to manage and how to monitor your blood pressure. So you have went ahead and demonstrated that you are knowledgeable and okay to do that on your own. So just make sure the same technique that we've been teaching you, you're doing that at home as well. So some side effects of the medication that some people may experience are a loss of taste, dry cough, dizziness, or headache. So you want to make sure that you're changing your position slowly. So making sure that you're going from a laying to sitting position slowly and then a sitting to standing position slowly so you don't have any falls. Some contraindications for this medication are if you have a history of angioedema, which you do not have, allergy to ACE inhibitors, which you also do not have, as you stated. If you are currently pregnant or decide to get pregnant, we want to make sure that you go ahead and discuss this with your doctor before, because it is contraindicated, which means we don't want you taking this medication while you were pregnant. So they may have to switch you to a different type of medication to manage your blood pressure during that time. Also, if you have a history of high blood potassium levels, then we want to make sure that you notify your doctor as well, which in your history, and since you've been here, you haven't had that, so you're okay. But if you ever hear later on that you do have that, then that's something that will need to be monitored pretty closely. There are also some certain medications that may interact with your lisinopril, and some of them are other ACE inhibitors, so any other blood pressure medication in this class, because they're both going to be doing the same thing, and in the end it can result in your blood pressure being too low. Also, any insulin may also interact with this medication, and it may result in lower blood sugar levels. There are also some foods that may interact with this medication. So some of them are high potassium foods or potassium substitutes. Some examples of these are your potatoes, your spinach, bananas, so fresh fruits, green leafy vegetables, and they may result in increased blood potassium levels. So some signs and symptoms, if you experience any of these, we want to make sure that you're notifying 911 or someone who's with you, so they can get you to the hospital right away. And these are some signs and symptoms that may indicate that you either have a possible allergic reaction to the medication, increased potassium levels, or maybe the medication is affecting your liver in a negative way. So these symptoms are some swelling in your hands, feet, face, lips, or throat, or your tongue. If you notice any muscle weakness, any chest pain, irregular heartbeat, or also if you notice any dark yellow or brown urine, and this is not just your typical you're dehydrated, you haven't drank any water, but a significant color change and you know that you have been hydrating well, like I said, you want to go ahead and call 911 if you're alone, or notify whoever is with you to get you to the nearest emergency room, because these are indications of a possible reaction. So, Ms. Smith, do you have any questions for me? I know we went over a lot of information. No? Okay, so since you don't have any questions, we're going to go ahead and get you ready to get you completely discharged. Like I said, this handout is for you to take home. Any questions that may arise, you can go ahead and refer to this handout. If there's anything that you may think of when you get home that we did not cover and it's not in this handout, feel free to go ahead and call your primary care doctor, and they can go ahead and answer any questions you may have. And that's all I have for you. Thank you for letting me take care of you, and I hope you have a wonderful day.